This video is to talk about the Educational Diagnostician Test Prep. Specifically, we are going to be talking about some interventions we can write in our constructed response of this test. When we are writing some recommendations, we might tend to be a little bit general, but we actually have to be specific. So I'm going to present the following example that says, to increase phonological awareness, engage the student in a variety of activities that focus on the sounds of words. Instead of writing this, we should write to improve sound blending abilities, provide the student with direct instruction in sound blending using the following steps. 1. Have the student to say the word. 2. Present the word with prolonged sounds, but not break between the sounds and ask the student to say the word. Next, you are going to present the sounds with a short break between them and ask the student to say the word. And the fourth step will be present the word with a quarter second, then half second, then a 1 second break between the sounds, with the student saying the word after each presentation. Another example is that instead of writing when teaching the student vocabulary, use a variety of activities that involve active learning. Instead, we should write, when teaching vocabulary to a student, follow the steps. 1. Write the word on the board and ask the student to guess the meaning. 2. Record his or her guesses. 3. Write the word used correctly in several sentences and have the student guess again and record his responses. 4th, look up the word in a dictionary and compare his guesses or her guesses with the dictionary definition. Something I want you to notice is we try to give steps to be more specific in the activity, in the intervention we are recommending in our writing assignment. Recommendations for oral language difficulties. In this case, we can talk about phonological awareness, which is the ability to detect and manipulate speech sounds, which are phonemes. We also can make recommendations about oral syntax, which is the ability to order words correctly in sentence. We also can recommend about receptive and expressive vocabulary, which is the ability to understand words. And also we can recommend about listening comprehension, which is the ability to understand spoken language. And also we can recommend about pragmatics, which is the ability to use language for social purposes. Recommendation for reading difficulties can include 1. Beginning knowledge of phoneme grapheme sound letters correspondence. 2. Phonics knowledge, which is the ability to apply phonic skills to word pronunciation. 3. Sight word vocabulary, which is the number of words recognized instantly without phonics analysis. 4th, reading fluency and rate. 5. Comprehension. 6. Reading strategies, which is the use of an active application of procedures to improve reading performance, like self-monitoring and rereading. Next, we can make some recommendations about writing difficulties, which basically include these three aspects, which are 1. Handwriting. 2. Basic writing skills, which includes spelling, punctuation, capitalization rules, writing mechanics, and a strategy for editing. And number three, we can recommend about reading expression. For example, we can recommend about rewriting strategies that involve brainstorming and organizing ideas prior to writing. We can recommend the use of graphic organizers and outlines for organization purposes, strategies for paragraph organization like writing clear topic sentences, clear details to support the topic, and summarizing the information in a concluding sentence. Or for essays, we can talk about transitions and organization. Next, we can make recommendations for difficulties with attention, organization, and homework. For example, we can talk about classroom adaptations, which is we need a highly organized teacher that has clear rules with daily schedule, minimal noise, transition system with interactive activities, and we also can recommend behavior management techniques. We can also recommend for behavioral and emotional as well as social difficulties. For example, number one, setting expectations that adjust for behavioral difficulties. Two, implementing classroom or home behavior management system. Three, increasing immediate and frequency of rewards. Four, teaching person self-monitoring strategies. Five, establishing goals with the person. Six, identifying reinforcements. Seven, implementing reinforcement system. Eight, severe behaviors like counselings or family therapy is what we recommend for these severe behaviors. Nine, for social, we can, for example, receive a program of social skill training that directly addresses his ability or her ability to recognize and interpret nonverbal communication, respect personal space, interpret language cues like voice, pitch, tone, volume. Next, we would like to do vocational recommendations in our reports, and it has to include, for example, provisions of relevant work experiences. Number two, skills needed for independent living. Number three, vocational training. Number four, career and technology courses. And number five, related services, which could be rehabilitation counseling. And this is the source I find this information on. Thanks for watching. Please subscribe to my channel. Thanks.